Hello everyone. Today is March 4th, which is marked as World Obesity Day. With this year's global theme, Changing Perspective, Let's Talk About Obesity, we will be talking to subject matter experts from RCSI Bahrain about obesity management and its recommendation in adults and children to encourage positive action. Professor Naji, through your extensive research on obesity and metabolism, obesity is considered a complex disease and multifaceted. What is the current research on its mental health, physical activity, and environmental on the development of obesity?
So thank you, Amna. I think that's a fantastic question. And the main word that you mentioned there is it's a disease. And that's a very, very important part because unfortunately we don't treat it as a disease. The World Health Organization, the American Medical Association, all have recognized obesity as a disease. And it's very, very complex. It's not something of willpower, which we often attribute to patients. You're not trying hard enough, you're eating the wrong foods. It's so complex because it involves genes, it involves the environment, it involves hormones in your body that fight you to gain weight and make it hard for you to lose weight. Now, mental health, physical activity, the environment are all very important there. We know that people with mental health disorders are at a higher risk of developing weight-related issues. So the mental health is one aspect that needs to be treated in patients who are struggling with obesity. We know exercise is very, very important. Now, the importance of exercise is on your health. People often think that if you exercise, you're going to lose weight. Unfortunately, the research doesn't support that. But the important part to emphasize with people is that it's so important for your health. So you can struggle with weight, but at the same time exercise. That's very, very good for your health. Now, the environment is also very important because we need to change certain aspects in terms of the foods we get exposed to, the foods to be able to address this disease. So to address obesity, we have to target different components, including the environment, but also different parts that are affecting our body.
Professor Naji, what are the latest recommendations for obesity diagnosis and its management in adults?
So that's very important to address because doctors see patients with obesity all the time, but it's important that they have the tools and they recognize how to approach it and treat it. In the past, we used to tell patients, you know what, go change your diet, cut down on certain foods, go exercise, and you're going to be fine. Now, clearly, this isn't working. And that goes back to your first question on why obesity is a complex disease. So diet and exercise are an important part, and they are the cornerstones for the treatment. But there are other aspects that need to be considered. So things like medications need to be considered. Things like bariatric surgery need to be considered. I'm not saying that every patient needs bariatric surgery, but certain patients do benefit from bariatric surgery. And it's that combination of treatment. So addressing lifestyle, addressing mental health, increasing physical activity, but also considering medications. And the reason I mentioned that is we emphasize the word that it's a disease. So let's say you have someone with high blood pressure. How do you treat high blood pressure? You give them medications. Obesity is a disease, and you also need to treat it with medications. So that's a big shift in the way we treat obesity. In the past, it was just focused on lifestyle. Now, lifestyle is the cornerstone, but you have to use other tools as well.
Obesity can develop in childhood. However, it is luckily preventable. Can you describe to me the effects of childhood obesity?
Children with obesity are at higher risk of developing sleep apnea, asthma, joint and bone problems. Studies have also indicated that children who experience rapid weight gain during early childhood are more likely to continue to become overweight or obese during adolescence and beyond. And as they progress into adulthood, if they continue to be overweight and obese, they are at significant higher risk for developing non-communicable diseases such as diabetes and heart disease. This could also aggravate the risk of developing anxieties, depression, and life-threatening situations.
Danah, what are the latest obesity prevention recommendations that parents can follow to support their children to maintain a healthy weight?
Prevention starts even before conception, when parents-to-be assume active measures in order to maintain a healthy weight and an active lifestyle, especially during pregnancy. And at birth, mothers should be supported and encouraged to exclusively breastfeed and avoid adding any breast milk substitutes. That is because breastfeeding is associated with a significant reduction risk of obesity and overweight among children and adolescents. Parents should also engage in positive role modeling. by role modeling healthy behaviors and active lifestyles. So the first step starts with moving together as a family. Research also recommends that younger children should be active throughout the day at small intervals, and school children and adolescents should be active for at least 60 minutes, either through school or after school activities. Screen time should also be limited, because when children are overexposed to screen time, they are at higher risk of becoming inactive, exposed to unhealthy advertising, and snacking on unhealthy food as well. It could also have an effect on sleep as well. And it's important for children to maintain a good sleeping routine, because lack of sleep can actually also contribute to increasing the risk of overweight and obesity across the age spectrum. Another important aspect that parents should consider is also role modeling healthy eating behaviors for their children. For example, they could engage with their children in healthy shopping, choosing fresh vegetables and fruits over eating processed food. And then also engage the children in cooking and preparing family meals as well.
Can you tell me how parents can communicate with children and adolescents about obesity and health?
Well, we've established that obesity is a family challenge, and many parents might struggle with misconceptions and stigmas around obesity. So they might find it difficult to open this discussion with their children. And it's important for parents to recognize that they have to manage this situation in a very sensitive manner to avoid long life implications that are associated with stigmas and misconceptions around obesity. The first step is for parents to initiate an open dialogue by encouraging children to express their thoughts and their feelings around body image. It's important for parents to listen attentively to their children and acknowledge their feelings as well. And if children are exposed to negative thoughts or comments around their body image, it's important for parents to be able to identify those thoughts and address them appropriately at a very early age. It's also important for families to avoid negative comments, shaming, punishing, or threatening children around lack of activity or unhealthy food habits and their weight as well. Parents in general should never use screen time or food as means of reward or punishment when it comes to children. And in fact, they should be engaging their children in selecting healthy activities for the family to do together. For example, engaging them in considering swimming as a family activity during the weekends, or family walks after everybody comes back from school and work well-being.
Thank you so much, Ms. Danah, on that insightful information. Thank you all for listening.